Well, hey there, I'm Joshua Johnson. It's great to be with you on this Wednesday, February 9th. And tonight we're talking about moving on from COVID. More states say the pandemic is easing enough for them to eliminate their mask mandates. The Biden administration remains cautious about doing the same, at least for now. So how do we know when it's safe to move on from mandates? Voters in Alabama hold their midterm primaries this May with a controversial new district map in place. Last night, we heard from the state's top elections official. Tonight, we'll ask the head of Alabama's NAACP, what happens now? Also, cars have to carry insurance in case someone gets hurt. Soon, San Jose, California will set a similar rule for guns. San Jose's mayor joins us live to discuss this unique ordinance and the legal challenges it could face. And can food bridge the cultural divides in Israel? It already is, with Arab and Jewish chefs joining forces for a unique festival. So how about some good news to start the show? You know, when it comes to COVID cases and hospitalizations, as we've told you in previous programs, things are continuing to improve. We'll have more on that in just a second, but first let's begin with some breaking news on vaccines. The CDC says that it is planning to roll out vaccines for children under the age of 5. That's the only group that's currently still ineligible for the shot. A CDC document shows that could happen as soon as February 21st, and again, that will be for children under the age of 5. Meanwhile, by our count, COVID cases in the U.S. are down nearly 63% in the last 2 weeks. Now, if you're a frequent viewer, you may remember we showed you these same numbers on Monday. But look at the change. On Monday, the average daily case count was more than 304,000. That was down about 57%. Today, it's just over 244,000. That's a larger drop. Now, as for hospitals, facilities in Georgia, Kentucky, and North Carolina are reporting high stress levels, but look at the overall trend line for hospitalization. Still high, but inching downwards. And new cases per day, nationally, higher than we'd like, but they are declining. Now, because of these improvements, a number of states are beginning to roll back some of their mandates. That includes here in New York. Today, Governor Kathy Hochul announced that the statewide vaccine or mask requirement for businesses will end tomorrow. Let me say that again. It's just for businesses. Schools will still require masks. New York State has reportedly been talking to school boards, teachers, and parents as it charts the path forward. In Illinois, Governor J.B. Pritzker is lifting their indoor mask mandate on February 28th, but that does not apply to schools, nursing homes, or to hospitals. California made a similar move on Monday. It is lifting indoor mask mandates for vaccinated residents, but it's leaving the school mandates in place, and unvaccinated residents still must wear masks. All these states made rollback announcements just this week. Look on your screen. Most of them are planning to drop their school mandates, including Rhode Island, New Jersey, Delaware, Oregon, Connecticut, and Massachusetts. Again, they are planning to drop those mandates. For now, those school mandates are still in place. As for the CDC, it's not changing its guidance on masks, at least not yet. Its director, Dr. Rochelle Walensky, made that clear in today's COVID briefing.
At this time, we continue to recommend masking in areas of high and substantial transmission. That's much of the country right now in public indoor settings.
Meanwhile, Dr. Anthony Fauci has struck his most optimistic tone yet. He told the Financial Times that we are certainly heading out of the, quote, full-blown phase of the pandemic. Dr. Fauci added that eventually these precautions would be set, quote, on a local level rather than centrally decided or mandated, unquote. Joining us now is Dr. Rob Davidson, an ER physician in Western Michigan. He's also the executive director of the advocacy group, the Committee to Protect Healthcare. Dr. Davidson, welcome to the program.
Thanks for having me.
Let me start with that breaking news out of the CDC that they are planning to roll out vaccines to children 5 and younger. I'd like to get your thoughts on that, particularly the impact you think it might have where you are.
Well, I think where I am, where I practice, we only have about a 44% fully vaccinated rate for all adults. And so it probably won't have a significant impact, unfortunately. I'm in an area of skeptics, unfortunately, people who voted for the former president about 2/3 of the time. However, I think for parents who are concerned, parents with kids 5 and under, this is such extremely good news. I think those folks have been saying to all of us, listen, you're lifting mask mandates. You're telling us, we need to get back to normal, but we have kids we can't protect. We have kids who could go out there and get other people infected and frankly get sick themselves. I think it's exciting news for them. And I hope as many people as possible avail themselves to these amazing vaccines that have saved so many lives.
Anything in particular you'd advise parents who may have questions or concerns, other than just to talk to their pediatrician, but anything you'd advise them to keep in mind as they decide whether to vaccinate their young children?
Well, first, that would be the most important and probably above anything else by tenfold is talk to your own family doctor, pediatrician, because that's the person you've trusted all these years to give your kids the other vaccines, right? The chickenpox vaccine. We only used to have, a few hundred people a year die from chickenpox, 11,000 hospitalized, and yet we recommend chickenpox vaccines because it causes significant morbidity and some deaths, and so this virus that we've been dealing with for 2 years has caused far more deaths than that, far more hospitalizations in kids, the multi-system inflammatory syndrome, to name, and then kids with long COVID, kids I see with headaches and fatigue. And so all of these things are real, they can be prevented, and I would do that myself if I had kids for that age, for sure.
I wonder what you make of these mandates that are beginning to come down. And again, a lot of the mandates have to do with businesses. Very few, if any, right now are for schools. But we did speak to our medical contributor, Dr. Kavita Patel, about lifting some of these mandates. Here's part of what she told us. Listen.
Joshua, look, I think planning for these changes is exactly the right tone to strike. I do not think that getting rid of these masks, and especially in our schools, particularly daycares or even where we have young children, where the vaccine uptake rate in the under 12 population, Joshua, is really low. And honestly, masks should be last. That protects individuals, and that should be one of the last to go.
Dr. Davidson, how do you see it?
Listen, I love Dr. Patel, and I would disagree with her if I did, but I don't. I agree with her completely. Here's a couple of challenges for me. Early on, we said over 5% positivity rate. That was high, and that was something that was concerning, and we should be doing everything we can to mitigate. We had numbers in my community. We've had numbers over 40% test positive rate. We're down to about 30 now, and we're almost breathing a sigh of relief, but it is still crazy high. And so in a lot of these places, I just looked up the numbers. In New York City, it's still about 8%. In California, it's around the same. Those are much lower numbers than we had when Omicron was at its peak, but they're still very high. Transmission is still substantial or high in most of the country, like Dr. Walensky said. That's one part. The other part is I feel like by focusing so hard on lifting these mandates as soon as possible, we're giving some credence to the group of people who claim that a mask is somehow an abridgment of their freedom. It is somehow some Herculean task to put on a face covering. And I just think that is crazy to give any credence to that. So many of us, when we fly, when we go into businesses, schools, I go to work, I wear a mask all day. It just isn't a big deal. I wish we could get back to talking about such a simple task to protect yourself and others. It really should be the last thing we get rid of because it's so easy.
I wonder what you make of Dr. Fauci's comments where he said that we're heading out of like the full-blown phase of the pandemic. On the one hand, I have no reason to distrust Dr. Anthony Fauci. On the other hand, I keep remembering that COVID did not agree with us, that it was going to slow down, and there may be yet another variant, my Greek alphabet is failing me, but something after Omicron that is more communicable, more virulent than what we've seen so far, maybe more on par with Delta. So I don't want to ignore the science that says things are moving in the right direction, but I don't want to ignore the science that says another variant could show up either. How do you see it?
I think you're looking at it exactly right. The reality is when you go to the doctor, when you go to the hospital, and we recommend a treatment for you for almost anything, that has gone through years of study, years of research, studies that proved one thing worked, something else may have worked, something worked a little bit, you test dosing, years and years, but it's all behind the scenes. It's in journals, it's at conferences. this is all happening out in the open in real time. And so it does feel a bit like Groundhog Day to say, well, we've survived Omicron. We're coming out of this, because still 2,500 people are dying every day. That doesn't feel like getting anywhere close to something we can just live with. And so I'm hopeful. I think he is striking a hopeful tone, but I think we all have to keep in the back of our minds, this virus may not be done with us. These variants can change, and the more people, frankly, who don't get vaccinated, the more likely that happens. The more we withhold vaccines from the rest of the planet, the more likely that is to happen. So yes, be hopeful, but let's be vigilant and understand that this could change. It's not the science changing. It's just that science is gray. It is rarely black and white, and we never know when we're over with something like this until we actually are.
And hey, if you are watching in Western Michigan and you are ready to get vaccinated, this does not have to be a loud political statement. You can do it quickly, quietly. Only you and your doctor need to know. If you go to planyourvaccine.com, we can help connect you to physicians who will vaccinate you. You can hold the same political views you've always held out loud and still do this to protect yourself and your family. Planyourvaccine.com if you're ready to get your shot. Dr. Rob Davidson, I appreciate you making time tonight. Thank you.
Thank you for that. Thanks.
Now, the U.S. is not ready to lift its restrictions on COVID nationwide. Meanwhile, England could do it in less than 2 weeks. That would be a month earlier than planned, a month. Today, British Prime Minister Boris Johnson announced this to the House of Commons. But his cabinet has been under heavy criticism, accused of breaking their own COVID rules to throw parties. From our partners at Sky News, health correspondent Ashish Joshi has the story.
Well, I waited 6 hours for an ambulance, which they said they weren't going to send one, and some kind bloke stuck me in a car.
Stuart Hardwick broke his arm after he fell over waiting for the bus.
You think you have?
He was brought here to Coventry Hospital, and now he's tested positive for COVID.
When did you find out that you tested positive for COVID?
About 2 hours ago.
This is the challenge facing hospitals like Coventry. Around 80% of its COVID cases are patients who are not primarily suffering from the virus, but need treatment for something else. The hospital is effectively learning to live with COVID. And now the Prime Minister says it's time for the country to do the same.
Provided the current encouraging trends in the data continue, it is my expectation that we will be able to end the last domestic restrictions, including the legal requirement to self-isolate if you test positive, a full month early, Mr. Speaker.
Looks like we've got a busy day in the cath lab again, so
Professor Kiran Patel has been preparing his hospital for business as usual. And that means trying to function as they did before the pandemic, but with the virus still in circulation.
infection control is paramount and has been paramount throughout the pandemic. But of course, just like any measures related to the pandemic, we will be phasing back into business as usual.
So as far as you're concerned, is your hospital now managing COVID-19 as if it's endemic rather than a pandemic?
I am quietly confident. I think this is the beginning of the end.
Like the hospital, the Prime Minister says his decisions are also driven by the data.
This is a hugely important and significant moment. The Prime Minister is effectively calling the end of the pandemic, but we're still recording over 1,000 deaths a week, and for some people, it's just too soon.
Our most vulnerable are worried they are being put at risk.
There is a narrative amongst some sections of society that goes, well, if you're vulnerable and you're worried, just stay in then. Well, do you know what? Actually, we've done that for nearly 2 years, since March 2020. We'd like our lives and our liberties back as well, more than anybody. We really miss those like normal things too.
Stuart's tests are continuing. He might require more treatments. I told him what the Prime Minister had just announced.
So it's not over as far as you're concerned?
It's not over as far as I'm concerned.
Ashish Joshi, Sky News in Coventry Hospital.
Some breaking news now from the entertainment industry that we learned just a few minutes before going on the air. You may recall the death of actor and comedian Bob Saget. Well, we just got a statement from his family with more information on how he died. The statement from the family states that the actor died from head trauma. They write, quote, "The authorities have determined that Bob passed from head trauma. They've concluded that he accidentally hit the back of his head on something, thought nothing of it, and went to sleep. No drugs or alcohol were involved," unquote. Now, the details of how they found this out or why he might have hit his head are not part of the statement. That part remains unclear, and the family is asking for privacy, understandably. We remember Bob Saget, of course, as Danny Tanner on the sitcom Full House. You remember him from America's Funniest Home Videos and from some blisteringly funny stand-up sets that were anything but family-friendly. And we also recall he was found unresponsive in his hotel room in Orlando on January 9th. He had performed a show the night before in Palm Valley, Florida. That's just outside Jacksonville. Actor and comedian Bob Saget, survived by his wife, Kelly Rizzo, and 3 children. He lived to be 65. We'll have more on this as we learn more. Up next, we'll have more on Alabama's controversial new congressional map. Critics say it could dilute the voting power of black residents. The president of Alabama's NAACP chapter says it is not done pushing to change that map. We're glad you're with us for Now Tonight from NBC News. Alabama's primary election is just over 3 months away. Chances are its congressional races will get extra national attention because of who gets to vote where. Yesterday, the Supreme Court allowed Alabama's congressional map to stay in place for the primaries. A lower court had ruled that this map violated Section 2 of the Voting Rights Act. 3 federal judges, 2 of whom were appointed by former President Trump, found that the map diminishes the electoral power of black voters. The lower court ordered the Alabama legislature to draw a new map that includes, quote, 2 districts in which black voters either comprise a voting age majority or something quite close to it, unquote. Last night, we spoke with Alabama's Republican Secretary of State, John Merrill. He expressed confidence that the state is doing its part to help everyone vote.
In our state, 26.7% of our population is African American. 69.1% of our population is white Alabamians. And I think it's important to know that it's difficult to make sure you had 2 proper congressional districts drawn in order to make sure that those African Americans are represented with 2 majority-minority districts, simply because you don't have that many African Americans living in the same geographic area.
Joining us now is Bernard Simulton, the president of the NAACP Alabama State Conference. Mr. Simulton, welcome to the program.
Thank you. I appreciate you having us on, Josh.
Could you just contextualize for people who may not be real familiar with Alabama what the impact of these maps would be from your view? Like, can you give us an example of what it would mean to have this map in place come May?
When you say this map, I'm assuming you're talking about the map that the NAACP and other organizations have put forth.
Well, yes. I was referring to the map that the state of Alabama has right now, the map that was the subject of these lawsuits, just to kind of illustrate what the harm is that critics of the map say that it would do.
Well, it has diluted the black vote in the state of Alabama. Alabama has over 27% of African-American voters in the state. And if you take those votes and put them all in one district, you dilute the vote of the African Americans in the state. And that's what we're trying to do with having 2 predominantly black districts, is so that each vote will count equally and that we will be able to elect the persons, in this case, of our choice to go to Congress.
We heard the Secretary of State in last night's conversation say that it would not be easy to draw 2 majority-minority maps because of the way that the black population in Alabama is distributed. How do you respond to that?
Well, I'll tell Secretary Merrill to look at the maps that we have put forth, and he will see that you have 2 majority black districts if you look at the maps that we have put forth. What he's doing, he's discounting the maps as not been legal maps, and therefore his premise is that these maps are does not meet the requirements of the Voting Rights Act of 1965, but they do.
Tell us more about Alabama's black population. The census showed that the black population of Alabama rose by 4% from the 2010 to the 2020 census. the white population of the state shrank 2%. Where in Alabama is this population? Is it mostly around big cities like Birmingham, Mobile, Montgomery, or is it elsewhere?
Well, that's where you're seeing certainly the concentration of black voters in Huntsville, Alabama, in Birmingham, and Mobile, and in Montgomery. That's where the population is growing. Also, you're seeing an increase in the black population in the Black Belt, and that's where we want to concentrate the second congressional district is in the Black Belt, where there are a significant number of African Americans. What has happened is over the years, they have kind of discounted the Black Belt voters and have not tried to put them together as a community of interest. And that's what we're trying to do in this new map.
So you've got more black voters in urban areas. You got black voters in this Black Belt, this historically, largely black agricultural region that has been historically black for generations for reasons that remain historically very clear. But these maps, it looks like, are going to be in place for the May primaries. They might change between now and November, depending on what happens in the Supreme Court. So what's the NAACP's next move? It would look like these maps are a done deal, at least for the primaries.
Right, and we know that more than likely they will be in place for the upcoming primary and the general election. However, there's an election in 2024, and we believe that when we have the arguments, which we anticipate being in the fall, that the Supreme Court will look at this the same way that the lower courts looked at it and say that Alabama must have 2 congressional black districts in the state because of this population. And we can draw those states without, those maps without them being gerrymandered. And we have presented the map, and the legislature, of course, refused to adopt those maps. And the only option that we had is to go to the courts to get them to look at it. And the lower courts agreed with us that Alabama should have 2 predominant black minority districts based on its population at 27%. And if you do the calculation math, 27%, that would equate to approximately 2 districts with 7 congressional districts in the state of Alabama.
Before I have to let you go, I wonder where this goes on a federal level. The decision out of the Supreme Court was not a ruling on the value of the maps. Justice Kavanaugh was very clear. He was not ruling that the maps were okay. He was just saying that they could stay in place for now. Yesterday, 44 members of the Congressional Black Caucus wrote to the Attorney General, Merrick Garland, asking for the Justice Department to, in their words, leverage the full might of the Department of Justice to defend the sacred right to vote for all Americans. I wonder what your sense is like of where this goes nationally. I asked the Secretary of State if the Supreme Court did not have a strong conservative-leaning majority, what would this have looked like? He ducked the question by calling it a hypothetical. But I wonder what your sense is of what this fight looks like on a national level, particularly with what national politics look like right now.
Right. Well, I think if you look again at the lower court's ruling, because those judges were judges appointed by, quote unquote, Republican presidents. And if the court had had time to hear the arguments, the Supreme Court did not want to call the Alabama election to go into chaos, but they should have ruled that Alabama, start drawing your maps. The NAACP and other organization has presented you a map to come up with 2 black congressional districts, and that's all they had to do. But the Supreme Court, kind of in my mind, took the easy way out and said, well, it's because of the timing, we cannot allow this to happen. And so we look forward to hearing the arguments in court in the fall, hopefully, and we still support them doing it now if the courts will allow it, meaning that to draw 2 congressional black districts for the upcoming election. But certainly in 2024, they should have 2 black congressional districts.
Bernard Simulton, president of the NAACP Alabama State Conference. Mr. Simulton, thank you very much.
Thank you, Josh. We look forward to talking to you in the future.
Still to come, San Jose, California just passed a unique law on guns. Not about gun control, but harm reduction. What's the plan? And how might this ordinance hold up in court? San Jose's mayor joins us just ahead. Stay close. San Jose, California is trying a new approach in its fight against gun violence. Last month, the city council overwhelmingly approved a new ordinance. It requires gun owners to carry liability insurance and to pay a fee to the city, and that money will fund gun safety initiatives. How exactly will the liability insurance work? And what is the city's strategy to defend this measure against lawsuits over the Second Amendment? Joining us now is San Jose's Mayor, Sam Liccardo. Mr. Mayor, welcome. It's good to see you again.
Great to see you again, Joshua. Thanks for having me.
So talk about the logic behind this measure. Why liability insurance and a fee? What would those accomplish?
This is about doing everything we can to reduce gun-inflicted deaths and injuries. We've seen how insurance can be effective, for example, in reducing fatalities in automobiles, where we've seen fatalities drop on a per mile basis by 80% over the last 50 years, because insurance companies incentivize drivers, say 20 years ago, to buy cars with anti-lock brakes or airbags, or to get good driver discounts. Similarly, we think that insurance companies can play a more active role in encouraging gun owners to be getting gun safes, trigger locks, be taking gun safety classes, and they're incentivizing some of their policyholders to do that now. We just need to ensure that everyone is getting the insurance and they're actually engaging with their insurance companies. So that's on the insurance side. On the fee side, we know there's a lot of programs we'd love to invest in around mental health, suicide prevention, domestic violence prevention. We're investing the dollars in the right time, particularly for those residents who live in a home where a gun is owned. That can have a huge impact in reducing the risk of gun harm.
I know you are a long-time San Josean, and I wonder where you see the largest challenges in terms of gun violence in the city. We know that there had been the shooting at the VTA rail yard not long ago. There was the shooting years ago at the Gilroy Garlic Festival, which is outside of San Jose, but not far, kind of on the edge of what we consider the San Francisco Bay Area. Are there parts of the city or aspects of gun violence, Mayor Liccardo, that you're most concerned about?
Well, those were certainly horrific events and devastating to our community. And certainly there are moments when we ask ourselves the question, if we had gotten to the shooter, for example, at the transit station, if we gotten to him a year or two before with mental health treatment in some way, could we have prevented that? Those are important questions, but the reality is those are the headlines of gun violence, and the devastation that takes place in our communities every day is overwhelmingly not what we see in the headlines, not the mass shootings. In fact, suicides are the greatest source of gun-inflicted deaths in our country. That's the majority of the deaths. More than a third of the emergency room admissions for gun-inflicted injuries are from unintentional shootings. So these are all preventable, and that's what's critical. I know a lot of folks wonder, well, what's this going to do to suddenly stop a crook from using a gun? Well, there's no law that will magically do that. What we can do is at least address the preventable harm that is happening every single day, and it's devastating families in all of our cities.
Let me ask you a few questions about the future of this, because I'm sure you have already braced for a number of lawsuits on Second Amendment grounds. Some Second Amendment groups, some gun rights organizations have already said that they are going to challenge this in court. First of all, how do you get around the Second Amendment concern? I could see this, at least the fee, being interpreted as a restriction on Second Amendment rights, as something that unduly burdens gun owners to fund programs in the city that you theoretically could fund in other ways by, levying a bond or raising taxes or something like that.
Well, certainly we've had taxes on guns and ammunition in this country since at least 1919. So that's nothing terribly new. We know that the litigants who have already filed lawsuits against us were exercising their Seventh Amendment right to do so. And when they went to the courthouse steps, they paid a filing fee. That's part of the exercise of their Seventh Amendment right. Similarly, a newspaper that was publishing a story about this may have had to pay taxes, and the Supreme Court has upheld taxes on newspapers' exercise of their First Amendment rights. So the reality is these are important constitutional rights. They need to be protected, but they are not without regulation. And the question is whether or not that regulation is an undue barrier. And I'm confident these are very, very modest regulations that will not prevent anybody who is law-abiding promoting or possessing a gun.
And what about ghost guns? That's been a real challenge in the state of California with guns that come across state lines, have the serial number scrubbed off, have some of the identifying marks, including just the shape of the barrel that marks the bullet as it's fired out, or guns that can be 3D printed for a single shot. I know this isn't the entirety of San Jose's gun prevention regime, but how does this lock into the rest of what San Jose is going to try and do to reduce gun violence? Before I got to let you go, Mayor.
Yeah, we need a lot of solutions on all these fronts. The state has passed a ghost gun prohibition. There are some holes in it, and so we're going to actually pass a regulation to plug some of those holes to ensure that we are doing everything we can against ghost guns. We've got guns, a regulation we just passed last year to prohibit straw purchasing by criminal organizations. We know that's another way that guns get to criminals. There's a lot more we can do throughout the country. This isn't the only regulation we should be passing. We just need more creative approaches because right now we know Congress isn't going to do anything. And that's certainly been the pattern for the last 2 or 3 decades.
And Mayor, forgive me, I got to ask one last real quick question for law-abiding gun owners who say this is another example of people in big cities making us pay for somebody else's problem, for the real problem of gun violence, which is people who aren't going to bother to register their gun with the city of San Jose. What would you say to them before we go?
Well, as I said earlier, the majority of gun harm is actually not about crooks using guns. It's about suicide and unintentional shootings. And that causes real harm that also poses real costs on the entire public. All of us as taxpayers pay for all the gun harm. And California was $1.4 billion in 1 year alone just to respond with emergency services and so forth. All taxpayers are bearing that cost. It's time for us to shift some of that burden onto the gun owners themselves so we can all be safer.
And since you mentioned self-harm from guns, Mayor Liccardo, I just wanted to, for those who may need the information, share the number to the National Suicide Prevention Lifeline, just in case that struck a nerve. It's 800-273-CHAT, 800-273-8255. You can also chat with someone online at suicidepreventionlifeline.org. San Jose Mayor Sam Liccardo, good to see you again, sir. Thank you very much.
Great to see you, Joshua. Thank you.
All right, let's update you on some of the stories we've been following here. First, the commissioner of the NFL broke his silence on that racial discrimination lawsuit brought by former Dolphins head coach Brian Flores. The suit alleges that the league paid lip service to hiring and retaining coaching candidates of color. Today, Roger Goodell acknowledged that the NFL has made progress when it comes to issues of diversity and inclusion, but there's still work to be done.
Roger, the league quickly came out after Coach Flores filed his lawsuit and said his claims were without merit. But then on Saturday, in a memo to all the clubs, you made it clear that you understand Coach Flores' concerns and the concerns of others. Can you understand why fans are confused by those two positions?
I think the initial reaction was regarding the legal claims themselves and not really what we would say the experiences of what Coach Flores was going through. And that's what I'm more interested in. I put the legal claims and the legal process to the side, and that'll be handled by lawyers. To me, it's more important for us to sort of listen to Coach.
Tomorrow, we're talking about the Super Bowl and gambling. More than 30 million Americans say they plan to bet on it this year. If you're one of them, we want to hear your story. Find us on social media, Twitter, TikTok, Facebook, Instagram. Leave us a voicemail, or you can email us now tonight at NBCnews.com. Until we meet again, I'm Joshua Johnson. Thank you for making time for us, and we will see you tomorrow night from Miami. Good night.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.